Hello. In this presentation, I'm going to go over pieces of Chapter 4, talking about client rights and counselor responsibilities. So first of all, counselor responsibilities. Counselors have numerous responsibilities related to safeguarding client welfare. The counselor is aware of and able to bracket or set aside their personal values. So this is something that we talked about already. But bracketing, remember, is again that setting aside of our personal values. So it's totally okay and it's normal to have our personal beliefs about certain things, certain issues, but we have to be able to set them aside so that we can really understand the person in front of us and understand their values and belief systems, and counsel that client the best that we can, considering our theoretical orientation, our code of ethics, and techniques that work best for the client in front of us and their issue. This also includes honoring diversity, being aware of our own needs and values, avoiding dependent relationships, and this is where we avoid allowing our clients to become too dependent on us. It's like it seems obvious, but it's super easy because we're helpers. We want to help people and we want to take care of them, and sometimes with certain populations, with certain clients, it can be easier just to do things for our client in order to make things better for them, and those are the things that we want to avoid because it makes them dependent on us. The purpose of counseling is for our client to be able to move forward and be in a better place without us, not to consistently need us. Respecting the rights of involuntary or mandated clients. Those are clients who are required to see us for whatever reason. Maybe it's because they've been court ordered, or if you work in like some sort of residential setting where counseling is part of their being there, they can certainly be involuntary or considered involuntary in terms of counseling, but they still have rights even though they're required to see us. Use appropriate counseling techniques. Again, considering things like diversity, research-based techniques, those sorts of things. Managing interruptions in and termination of services. So being careful about and being planful about interruptions of service or terminating service. And avoiding abandonment of clients. It is vitally important for counselors to be aware of their own needs and motivations in order to maintain a fiduciary relationship that keeps client welfare foremost. Without this awareness, counselors run the risk of meeting their own needs at the expense of the client. So we're not saying that you don't have needs, that you don't have values. We're saying that you do, and we have to be aware of them. It's that self-awareness that makes us a better counselor. Even if it's, being self-aware that you're having a really bad week, or a bad, time of your life. Maybe you're getting a divorce, or you're having problems with your kids, or you're just depressed yourself. So those things happen to us, and we know that, and we understand it. But to best serve our clients, we have to be able to understand when maybe we need to take a break, maybe we need to find other services for our client, if we're not able to put our own issues aside while we work with them. And if we don't have that self-awareness, we run the risk of meeting our own needs at the expense of the client. So we might focus on ourselves through the client relationship. We may, and maybe you've heard stories of counselors who, I know I have, of counselors who just talked about themselves the whole session, to the detriment of the client in front of them, and the client certainly never went back to see that counselor. And so that's what happens whenever you're not taking care of yourself first. Counselors have the right to their own needs, and some of these will be met through work with your clients. So we're not saying you're not going to be satisfied or fulfilled by your work, but we want to be careful about doing or saying things in a session that is because of what's going on in our own lives. Avoid fostering client dependency and enabling. Avoid inappropriate forms of countertransference. It does have pros, certainly if you like some of the psychoanalytic theories, there are pros to countertransference, and that's where we as counselors have feelings for our clients. And sometimes it's sexual in nature, but a lot of times it's not. So I'm thinking of a lot of the work I've done is career counseling work again, with college students, and I've got 3 siblings who are college age. And so there have been a couple times, I can think of one guy in particular who came in and he just like through and through reminded me of my brother. And so without intending to, I was treating him, I was making assumptions about him because of what I know about my brother. So I was making assumptions about his interests and about his personality. I was probably talking to him like a big sister would instead of a counselor, until I realized what I was doing. And so it, like I said, a lot of times we think of transference as countertransference, because it's coming from Freud and psychoanalytic theory. We think of it more as sexual, but it's not always. Sometimes it's just that person reminds you of someone else. Maybe a family member, maybe a friend. Maybe you like that person. You just like the person. You think you could be best friends. And that's a problem too, because we do have it's our responsibility to establish a certain relationship with our clients. Avoid misusing the natural sense of power you hold in the relationship to benefit yourself versus the client. So we come into counseling with a power differential where we're up here and our client's down here, and most counseling theories seek to even out that power differential, and it takes us being active in that balancing of power. It's important to be aware of that, and important to not misuse our sense of power to, encourage our clients to say or do certain things in the relationship. Counselors' personal and professional values. So standard A4B of the Code of Ethics requires that counselors be aware of and avoid imposing our own values, attitudes, beliefs, and behaviors on clients. The influence of the counselor values on the counseling process can be very subtle. And so we can communicate these values in many indirect ways. We can do this through our nonverbals. Just like some of you, I know I am, like my face just gets away from me, right? I make these expressions and I can't help it. And so that's one of the big things that we have to be careful of, making that face of, oh my gosh, did you really just say that? I know when I first started working as a school counselor, I was working with a really tough population, lots and lots of abuse and drug use and gang involvement, and it was a lot of things that I had not heard before, and it was really, really difficult to hear, especially from some of the younger kids. And so I was constantly having, obviously self-care was a big part of my first years working because of that, because it was such a tough population. But I was constantly having to be aware of my facial expressions, and because I'd have. So I remember one guy who came in and he was like 16, 17, and he came in and he was like, Ms. Hughes, can you, I've got problems with my girlfriend. I know it's not that big a deal, but do you have a minute to talk to me? And in my head I was thinking, yes, just a girlfriend problem. I can do this. It'll be a nice break, right? Because like I said, I was dealing with lots of heavy stuff. And we sit down and we're talking, and come to find out that his dad was an alcoholic, and he found his dad dead. He was the one who found him. His dad had passed away, and he found him. His dad threw him across the room at some point. He was telling me about the abuse that he endured at the hands of his father. And I remember, I think, at that point when I was meeting with them, it was certainly not something I hadn't heard before, but because he set me up, saying it's just girlfriend problems, and then he's telling me this, just one story after another, and I know my face was just like, it's those jaw-dropping moments where you're like, oh my God, how could someone have to go through that, right? And so the facial expressions aren't bad, because I'm empathizing with the student, with the client in front of me. But they do things, okay? So our facial expressions are every word we say, every thing that we attend to, every question we ask does something in the conversation. That's what we have to be careful about, because it's going to take the conversation, it's going to take the counseling session in a different direction. Focusing on some elements of a client's story while not responding to others. This one comes, for me, it happens a lot whenever clients are getting really emotional. I don't do emotions well. That's probably why I like career counseling. But not because, I can't handle emotions. It's because I think I'm just really empathetic, and it just wears me down. So a lot of times when I have a client who, and you can tell when they're going to cry, right? Somehow, when I'm doing career counseling, I end up with all the criers. My colleagues joke about that. But you can tell their eye, the person's eyes will start to well up and the face gets all blotchy. And when that happens, my first inclination is to crack a joke, or to say something funny, or to change the subject, right? To lead the conversation away from that hard thing that they're, talking about, because I don't want them to be upset. It's, part of it's about me being uncomfortable, part of it's about me not wanting to upset them, and that's not what counseling is, right? We have to be careful of those moments when we have that, just that instinct to say or do something because of what's going on in the conversation, and those are the things we have to be aware of, those personal inclinations that we have to react or to say a certain thing, because of our own values, because of our own beliefs, because of our own emotions, those sorts of things. Research shows that the degree of congruence between the values of the counselor and those of the client can influence therapeutic outcomes, and clients tend to change in ways that are consistent with the values of their counselor. So unintentionally, when we bring our own values into the situation, our client is going to, because of that power differential, right, they're going to start to believe in ways that we believe. And that's what we want to be careful about. Resolving value conflicts. So standard A4B applies here. Let me find that. I went to pull up the Code of Ethics, and then I realized that A4B is right here, that we avoid imposing our values. So that's one way to avoid value conflicts, is we bracket them or set aside. A11B prohibits making referrals based solely on the counselor's personally held beliefs, values, attitudes, and behaviors. This requires counselors to seek training in areas in which they are at risk of imposing their values onto clients. And this is where, again, we kind of harp on this issue, and I know in the ethics classes these days, because it's an issue in our field right now. It's something that's kind of reflective of what's going on. Again, with like the political and social climate of our country, but it's also the stance that the Code of Ethics has taken. And so, when it comes to counseling LGBT clients, it's up to the counselors to bracket our beliefs and set them aside if our clients' sexual orientation goes against our religious beliefs or personal beliefs. And it's up to the counselor to seek competency. So it's up to us, if we have an LGBT client in front of us, to make sure that we are competent at the, as the result of this program, you're going to be competent. But if you still feel like you need more training, it's up to you as a counselor to do so, to get that training. Diversity considerations. Counselors must develop cultural empathy in order to be effective in counseling clients who hold world views and come from cultures different from our own. Cultural empathy requires fundamental empathy skills, but also advanced skills that enable us to decode cultural messages. And there's more information on it, pages 86 and 87. And we talked about a lot of this in the diversity chapter. Avoiding dependent relationships. So again, this comes up. Again, because it can be a big issue, especially with certain populations. So counselors must avoid fostering dependent counseling relationships with clients. The goal of counseling should be to move clients toward an increasing autonomy and independence in their everyday life issues. Avoid the possible temptation to foster dependency due to a desire to feel needed, a need to nurture others, a need to feel important, a need for income from easy client fees. So, this is going to be more likely if you're in private practice, but those client fee, if you keep a client coming back to you, that's kind of a guaranteed fee, right? And so that's unethical to do. And like we talked about in the diversity chapter, in terms of like racism is not always, it's usually not that overt racism that we think of. It's like the microaggressions that we do as counselors. It's the same thing with this dependency. It's not like we're actively trying to, get our clients to need us. It tends to be more of a subtle thing where, again, we're helpers and we want to help people, and you have clients who come in who need you. And so you just kind of foster that relationship, and that's not what we should be doing. And some of it's hard. It's hard for us as counselors to do because you have to set boundaries, you have to cut people off, you have to keep to your time limits. Those are ways that we avoid those dependent relationships. And I know it's hard to do. I've certainly been guilty of whenever I've had a client come in and they were in there for an hour-long session. But I didn't have anyone coming in afterwards, and they were, in the middle of something. I tended to want to keep them longer because I knew I didn't have anyone coming in, and that's not to the benefit of the client, right? So keep letting people stay or talk longer than their allotted time. Establishing those clear boundaries. Those are things that are hard for some people to do, and most of us who are counselors have that difficulty, again, because we want to help people, and so we have to make sure that we're keeping boundaries. Some clients attempt to maintain or even increase their dependency on the counselor for various reasons. We saw this a lot at the alternative school, where a lot of kids just did better there, did better with the structure, did better with the teachers and the counselors working closely with them. And so they would, when they were sent back to their regular school, they would act out, get in trouble right away, so they could be sent right back to the alternative school. And so that wasn't, that certainly wasn't our goal, to keep them there. Our goal was to send them back home and for them to be successful, but that happened a lot of times. And, we see in managed care that there's limitations on counseling sessions. This has made it more difficult for prolonging those relationships. So if you're working through managed care, it's not as big of an issue. Diversity consideration. As counselors work to uphold their ethical obligations to avoid fostering dependency, they sometimes misapply the principle of autonomy. Counselors need to remember that autonomy is a highly individualistic concept, and the counseling goal of achieving independence or autonomy may not be appropriate for clients whose choices are made in the context of family, group, or community. And I would argue, and this is me coming from my own theoretical perspective, which is more of a relational, cultural perspective, which you learn about in the theories class. But I tend to think that we all, we're all social people, and so we are all coming from a context of family or community. Just some people to a lesser degree than others, and so it's important to understand that and to respect that, I think, and to value that support that people get from other people. So, for example, again, coming from that school career background, whenever I'd work in the colleges, I worked a lot of orientations, and so you'd have 18-year-old freshmen come in like for academic advising appointments or career counseling, and they would want to bring parents in, and the inclination of kind of the approach of the student services folks is to separate them and keep family members away, and that was something that I didn't necessarily agree with. I'm thinking of my own experiences of my own family, and I'm thinking, what ended up happening for me, I totally remember my first orientation when I was at college. I went and I made my schedule, and of course I just listened to the advisor, and she got me in all my classes. This was before you could register yourself and choose your own times and days, and she had to put me in, and then I went home and I showed my mom and dad, and my dad was like, well, that schedule sucks. You're not going to like it. And so we sat down, and he and I together looked at the options, and we came up with a better schedule. And so I had to go back, and I had to go again. This was before the computer age. And so I had to go back and fill out a form to get my schedule changed to one that I liked better. Had he been there with me for that appointment, he would have been more of an advocate for me, Again, the thought I know of a lot of student services folks is that we need to teach our freshmen to be independent, but I think also we need to be aware of that relationship, and just honor and respect it, because it's there. Why fight it? Why ignore it? And I think that's something that we need to consider in the counselor relationship as well. Involuntary or mandated clients. The term involuntary is inaccurate because the client who chooses to enter counseling rather than accept the alternative consequence is making a choice. And so, when I was working with alternative folks, we would kind of phrase their situation in that perspective. They didn't like being in the alternative school. They had to wear uniforms, and it was just rough on them, and so they would be really angry that they were there. And then we would say, you chose to come here. You had options. You could, be homeschooled. You could not have done something to get this way. It's in your power to get out of the school sooner rather than later. And so we would really highlight the choice in the situation. A lot of times in the involuntary situation, most are required to sign a waiver of their privacy rights when they begin counseling. So if they're court ordered to seek counseling, the court is often kind of the client versus the person in front of you. And so you are required to disclose information to the court. So we're going to see issues with motivation due to feeling coerced. Standard A2A states that clients must be offered the freedom to choose whether or not to enter or remain in counseling. Mandated clients do choose counseling, even though the choice may not be, their best choice. And I'm thinking of, in cases of substance abuse and addiction, you may, especially if you work in a residential setting, you may have clients there who don't want to be there. They are, even though they are maybe technically involuntary, they still made a choice to be there. If a family member said, all right, you have to go to rehab or you're being kicked out of the house, they made a choice. They may not have liked the choice, but they still made a choice. And so again, kind of highlighting that the choice, their role in the situation helps. And standard C6B states that counselors are accurate, honest, and objective in reporting their professional activities and judgments to third parties. Counselors must also promote client welfare by selecting appropriate counseling strategies or techniques. The strategies should fit your counseling style and be tailored to the specific needs of your client. Don't use treatment modalities that are unsubstantiated. And so that kind of goes back to that reparative or conversion therapy that we talked about with homosexuality. We don't do that because it's not substantiated and can harm clients. Standard C7A, counselors use techniques, procedures, and modalities that are grounded in theory. And standard A1C, counselors have an ethical responsibility to work jointly with clients to devise counseling plans that offer reasonable promises of success. Traditional counseling theories and techniques have limited applicability in working with culturally diverse clients unless they're adapted. So always keeping that in mind. Counselors seek training in a wide variety of counseling techniques, including those that originated in non-Western cultures. And so we do that through, like your theories class here, we'll focus on the more traditional theories and, the older theories that aren't necessarily in use as much today. And so you need to seek training, and we do that, seek that training through conferences and webinars in our continuing education. So it's out there, finding books, reading books, all those sorts of things help us to find out what the other theories are, the newer theories. And a lot of times, like if you work in an organization, they'll offer trainings for you as well, or will at least pay for it. Termination, counselors should raise and discuss the issue of termination with the client well in advance of the final session. And so if you're seeing a client for a short period of time, you're talking to them from the get-go about termination. Like when I'm doing career counseling, if I'm, a lot of times career counseling is kind of a one-shot deal, where they just come in for one session. And so I will talk about termination at the start of the session. I'll usually, I don't do this anymore because I don't do it, but I would say, all right, some people come in and they come in for one session and then they go on their own and they are able to kind of finish the process on their Or you can come back and meet with me over the course of 3 or 4 or 5 weeks, and we can do everything together. Which approach do you want to do? Because this first session is going to be very different if you're going to leave and never come back versus come back for a few weeks. And so that's just working, again, first working with the client to come up with a plan and an approach, but also talking about the end, working with the end in mind. Standard A11C says that clients should expect that their counseling sessions will end when they have received what they were seeking from counseling, realize the maximum benefit from services, and not likely to benefit from counseling further. And this goes along with that dependency. So whenever counseling is done, whenever the goal of counseling has been achieved, or whenever you can see that your client's not making any progress, you terminate. Premature termination. When counselors are unable to be of continued assistance, counselors must give adequate notice and give the client time to secure another mental health provider. Sometimes it's the client who terminates the counseling relationship prematurely. This probably happens quite a bit, where you have those clients who just come in for 1 or 2 sessions and then never come back. Standard A11C gives ethically permissible circumstances for routine and premature termination, and there's a list on page 91. If the client is unable to pay the fee, an appropriate referral can be made to free services or agencies that have sliding scale fees. If the counselor refuses the referral, the counselor is not obligated to provide free services, though. Avoiding abandonment. Abandonment is considered a form of inappropriate termination, and it can occur when the client's counseling needs are not adequately addressed by the counselor, either when treatment ends or during the course of treatment due to counselor unavailability. So you don't really want to take a month-long vacation and not make appropriate plans for your client. You don't want to just drop off the face of the earth. And sometimes, life gets in the way, you're hospitalized, you have something going on in your life. And that's, it's complicated and it's hard, but it's up to us to plan for those situations. Standard A12 and legal decisions prohibit counselors from abandoning their clients. Advanced planning can help avoid the risk that clients will feel abandoned by their counselors. And so, especially if you're working in private practice, if you have a plan in place for whenever things happen, a backup counselor, someone, a partner, someone working with you, where you've worked with that person and you have kind of a plan in place where they can access your client documents. Someone's going to be contacting their clients and letting them know what's happened. That helps for when life gets complicated. You have that plan in place, and so it's easy to implement it. The key to ending a professional relationship with a client properly and not being exposed to charges of abandonment is to give the client adequate notice that the relationship is ending. So ideally, things happen. Termination happens within the counseling relationship, and it is part of the process. But again, sometimes things happen, so we have to have plans in place. Informed consent. Clients have the right to know what they are getting into when they come for counseling. This is what informed consent is. It's informing them of their rights and counselor responsibilities. Counselors provide prospective clients with information that will enable them to make wise choices, including deciding whether to enter into a counseling relationship, choosing the mental health professional who seems best suited to their needs for the type of counseling they need. So part of informed consent is explaining your approach and how you do things, and making sure the client understands that there's other people out there who do things differently, and you may not be the best fit for them. Contract law. Informed consent is considered a contract. A relationship with professionals who provide services are contractual in nature. In terms of contract law, a professional in a private practice offers services to a recipient for a fee. The contract serves to protect both the client and the counselor in the relationship. Counselors have a legal obligation to obtain informed consent from their clients before they begin treatment with them. And it's delivered in a way that the client understands, so making sure that the language is readable and understandable, and that they get it, right? So it's not just about handing them a sheet and saying, sign this. It's about going through every piece of the document with them, explaining it to them, and then, with certain clients asking, I've certainly asked students to explain it back to me so that I know that they understand it. HIPAA requires verification or receipt with the client's signature. And finally, written disclosure statements. So written contracts for informed consent are commonly referred to as disclosure statements. These documents disclose to clients the nature of the counseling relationship. They're considered legal. Standard A2B spells out in considerable detail the elements that ethically need to be included in securing informed consent. And there's a list on page 97 and 98 for a suggested list of additional written disclosure topics. And so, if you're seeing certain populations, like if you're working with students or kids under the age of 18, consent is different for them. They're giving assent. Their parents or their guardians are giving consent. And so confidentiality works differently, right? And so you might have a little blurb in there about that, just for example. All right, that's it. Chapter 4. Kept it at 30 minutes. Great. See you in Chapter 5.